Hello to everyone from the sunny Northern Cyprus. When we are, oopsie, I'm sorry, start again from the beginning. Hello from the sunny Cyprus to you all. First of all, I wish you a nice presentation watch and thank you for your attendance. When we are choosing something and researching about it, we ask actually 5 W's and 1 H to ourselves, which are where, who, what, why, when, and how questions. If we are relieved with the answers, then we choose. That's what we do, that's what the companies do, and that's what the patients do actually. So let's start. Where is Northern Cyprus? Northern Cyprus is on a beautiful island just at the connection of the continents Europe, Asia, and Africa, just in the middle. So it's close to everywhere. The island country is well known with its paradise beaches, warm sun, and full comfort and peaceful accommodation and holiday options, which makes it a perfect choice for health tourism. There are direct flights from all Europe, Russia, and Arabian Peninsula to the island from various airports. And there are also cheaper flights over Turkey to the island as well. So the next question is who? Who are the Northern Cypriots? The island is a mixture of cultures combining Oriental and modern culture. The history of Northern Cyprus is a cultural mixture of English, Ottoman, Turkish, Arabic, Italian, French, Byzantine, and Greek ancestry. So that's why the Cypriot population is very hospitable and has a very helpful nature. Because of many universities that accept students from all over the world in the island, the population is used to the non-Cypriot community as well. The Cypriot people mostly talk English pretty well because of the history. And although Turkish and Cypriot cuisine dominates the culinary culture, there are restaurants and markets belonging to every culture in our country. What do we offer? There are 15 actively running IVF centers in Northern Cyprus, located as one university hospital IVF center, which is the nearest university that I work at, 4 hospital-based IVF centers, and 10 boutique IVF centers are occupied. In Northern Cyprus, we are authorized to do every type of donation IVF program, such as the oocyte donation, the sperm or the embryo donations, the surrogacy treatments, the conventional IVF treatments, the ICSI procedures, the sperm microchipping, the sperm sorting, and pre-implantation genetical screening of chromosomes, genes, or genetical sequencing in our university hospital as well. That's why we can do everything. Why Northern Cyprus? That's an important question because that's the question when the patient starts to think about a place and wants to get convinced, as we all know. First of all, we should state that the first thing is the success. The patients look at success in the first line, as we all know. We proudly can present the pregnancy success above the European standards for our patients. For example, in oocyte donation treatments, we have a pregnancy success rate over 60 to 70% in a single attempt. Since we can provide our patients with a good number and quality of oocytes, our patients almost always have the high quality embryos that we can freeze, so we can offer a much more economical treatment compared to the other countries. And we can keep our cumulative success rate above 90%, which is a miracle actually. In our treatments, where we can obtain the oocyte from the patient, we ensure the highest performance of the patient as tailor-based, since we act with the most accurate and patient-specific treatment principles. Also, innovation and technology is important as well. The patients ask for that as well. They want to get the best technology. In Northern Cyprus units, we use the latest technology that enables us to keep the pregnancy success rates high. And we can offer all services to our couples who need additional treatment without waiting list, which is very important. Not only that, also donation programs are especially being asked a lot. We can do all type of donation treatments legally. In all donation treatments, we don't have a waiting list, which is a huge problem in some countries. In the selection process of our donors, we use high standards for donor acceptance. For example, we combine both the HFEA, ASHRE, and ASRM recommendations, and using many genetic screenings, infectious disease screenings, including COVID-19 in the recent situation, psychological evaluation, and we provide the service above the world standards with our selected donors. Also, as the majority of our donors are the university students, we can provide not only good quality oocytes, but also precise genetic bases that are important to the patients as well. For the sperm donors, we get our donor sperms from fully certified sperm banks throughout Europe. We have the donor anonymity and 100% confidentiality. This is important for the patients as well when they are doing donor treatments, or sometimes in conventional IVF treatments as well. The patient wants to be sure about what she is getting or what they are getting. In Northern Cyprus, there is complete anonymity law for oocyte and sperm donations. That's why we are obligated to keep the records of the patient and donor matches in archives to be evaluated only in medical need, and to guarantee that the patient and the donor remain completely anonymous to each other under the protection of the law. So actually, we are doing it silently. So the patient does not know the donor and the donor does not know the patient, which is a huge problem in some countries as well, which is not a problem in Northern Cyprus. What else? Why we choose the Northern Cyprus? We can perform various genetic analysis, chromosome evaluations, such as including the X and Y chromosome, specific genetic screenings, or total genome sequencing up on the patient's request. And we get the reliable results very quickly, not like in 6 months' time. So the patient does not lose time. That's the important part. Also, as there is no marriage obligation, so there is no requirement for the marriage of the couples, if they exist as couples, we don't seek marriage conditions, so we can easily offer treatment to non-married couples, to single patients, and of course, to the LGBTI community as well. Other than that, the patients sometimes ask the budget as well. That's also an important part. There are options for every budget, and treatment costs are approximately half or 1/3 of the similar treatments in Europe or Asia when compared. The patient satisfaction is something else than the success. It's important because the success is the pregnancy, is the baby, but satisfaction is more than that. It's the baby and maybe the pregnancy, but also the patient turning to her own home country happy. That's the important thing. Not only before or during the treatment, but also after the treatment, we keep in touch with our patients and continue to provide the support and consultation services according to the need. And also, as we are combining the holiday and the treatment together, the patient is satisfied as they also have the holiday, the stress factor is minimized, which is very, very important in IVF treatments to achieve the pregnancy. And also the patients may sometimes wish not tell to their parents or their families about their treatments. Also, this little hiding island keeps the secret and the patient can have the treatment as well as the holiday and turn back to their home country pregnant. When to come? Before finishing, I may say that our patients may receive their pre-treatment consultations free of charge. So we do the consultations in professional guidance and programs online and complete the treatment's operational part in Northern Cyprus. Or sometimes the patients may want to pass the whole treatment procedure here, so they're more than welcome. So minimum up to the treatment option they are choosing, 3 to 8 days accommodation is enough for all the treatments actually. How to contact? We have our university, the hospitals, and the IVF centers. They all have accessible websites. Each center also offers direct contact options for the patients as well as the companies assisting the patients, of course. We're also able to do audio or video conferencing via internet or make direct phone calls for discussing our patients' medical conditions and or treatment options, of course. Almost all centers have patient coordinators talking English, Russian, Arabic, and many other languages fluently. Actually, there is no other way not choosing Northern Cyprus in IVF treatments, because in Northern Cyprus, we're not doing all the treatments. We are doing IVF. That's why we are doing it perfect. Thank you for listening. Please do not hesitate to schedule BNB meetings at the platform about anything you need to learn. Thank you very much.